Hi everyone, we are from Group 4 and today we would like to presenting about occupational health guidelines, biological, mosquito control, psychosocial, drug and alcohol, stress and violent health hazard. Next, I will introducing my group members. First, my name is Temfia Ajik Analintau and this is my teammates Kalista Ariana Majawin, Nur Fatina Ainsha Shariman, and lastly Nadiatun Afani binti Muhammad Ahir.
Occupational health guidelines in Malaysia. In the landscape of Malaysian industrial law, the Occupational Health Guidelines serve as a critical extension of the Occupational Safety and Health Act (OSHA) 1994, managed by the Department of Occupational Safety and Health (DOSH). These guidelines move beyond physical safety to address complex health hazards. This presentation explores the vital regulatory framework covering biological hazards to prevent infectious disease alongside psychosocial hazards such as workplace hazard, violence, and the management of drug and alcohols and stress and violence. Together, these standards form a holistic approach to ensuring a safe, healthy, and productive environment for both employees and the Malaysian community.
Under Section 15 of Occupational Safety and Health Act 1994, employers have a legal duty to ensure the safety, health, and welfare of employees at work. This responsibility also includes preventing risks that may affect people outside the workplace, such as visitors, contractors, and the surrounding community. For example, by controlling stress, workplace violence, drug and alcohol abuse, the Act helps prevent accidents, aggressive behavior, and unsafe action that could harm the public. The Act is enforced by the Department of Occupational Safety and Health, or DOSH. Employers who fail to comply may face legal action. We encourage safer workplace practice and indirectly protect public safety. All in all, OSHA 1994 protect the community by legally requiring employers to control workplace hazard and prevent risks that could affect the public.
Even though occupational health guidelines are important, there are still some weaknesses. First, these guidelines are not compulsory, so some employers choose not to fully follow them. Second, mental health problems like stress and bullying are difficult to detect, and many workers do not report them because they are afraid of being judged or losing their job. Third, enforcement is not strong, especially in small companies where inspections are limited. And lastly, not all workplaces have enough resources such as counselor and mental health program, which make the guidelines are harder to apply. And this is why some serious cases, such as workplace stress and COVID-19 outbreak, still happen even though the guidelines are already exist.
The COVID-19 outbreak at Tratai cluster. This was one of Malaysia's largest industrial biological hazard clusters, involving a leading rubber glove manufacturer. Over 5,000 workers tested positive, leading to the temporary shutdown of 28 factories. The virus spread rapidly due to cramped and poorly ventilated workers' dormitories. This highlighted a failure managed bioaerosol and cross-contamination in a shared living and working space. This case exposed the gap between the Occupational Health Guidelines and the Minimum Standard of Housing, Accommodations and Amenities Act 1990, Act 446. It showed that biological hazards don't stop at the factory gate; they include how workers are housed. The company was fined and forced to overhaul its hygiene protocols, proving that biological risk management is essential for business continuity. The death of a houseman at Penang Hospital. A junior doctor fell to his death just weeks after starting work. This sparked a national conversation about the toxic work culture and bullying within public hospitals. The case highlighted extreme psychosocial hazards, including sleep deprivation, verbal abuse, and lack of a mental health support system. While Malaysia has the guidelines on occupational safety and health for healthcare facilities, this case showed that psychosocial risks are often ignored compared to physical risks. It led to the formation of the Healthcare Work Culture Improvement Task Force. This case proved that the work-related stress and bullying are industrial hygiene issues that can be just as fatal as physical accident if not monitored through proper psychosocial risk assessment.
Next, I will talk about the cases based on this act. One example is workplace stress leading to violence and employee experience excessive overload, long working hours, and continuous verbal harassment from supervisor. Due to prolonged stress and lack of support, the employee become emotionally unstable and may engage in verbal threat or physical aggression toward coworkers. This situation does not only affect the worker involved, but also their family and the surrounding community, as workplace violence can escalate and threaten public safety. Under OSHA 1994, employers are responsible for managing psychosocial hierarchy, such as stress and harassment. The implementation of stress and workplace violence guidelines encourage early reporting, proper interventions, and zero-tolerance approach to violence help to protect community. Another example involves drug and alcohol abuse at the workplace. A worker report to under the influence of alcohol and drug while driving a company vehicle. Due to impairment judgment and reduced coordination, a serious accident occurred. This type of incident can cause injuries, loss of life, and property damage, not only to workers but also to members of the public. The Drug and Alcohol Guideline under OSHA 1994 require employers to implement a drug-free workplace policy. This helps reduce impaired behavior, prevent accidents, and ensure the safety of workers and the surrounding community.
In conclusion, the safety of the Malaysian community is linked to the health standards maintained within its industries. As shown by our case studies, failures in managing biological, psychological, and substance related hazards don't just affect the individual worker, it also affects the public. For Malaysia to move forward, occupational health guidelines must be treated with the same level of urgency as physical safety laws. By closing the gaps in enforcement, increasing mental health support, and holding companies accountable for the total environment of their workers, we can create a safer industry that truly protects both the workforce and the nation. Our recommendations consist of four main points. The first one is increase awareness and training on occupational health. The second one is improve mental health support at workplaces. The third one is shift from guidelines to mandatory compliance. Last but not least, implementation of holistic monitoring systems.
That's all from us. Thank you for your attention, and we hope this presentation helped to increase awareness about occupational health guidelines in Malaysia. Bye.